Broadcasting from Detroit's Cass Corridor, it's the Metro on WDET. I'm Robin Vincent.
And I'm Tia Graham. Today on the show, public systems are being tested in how we care for one another, how we educate young people, and how we respond when harm happens behind closed doors.
We'll examine changes in federal vaccine guidance and what they mean on the ground, where public health decisions collide with uncertainty, misinformation, and trust.
And we'll sift the history of the Packard plant, not as a relic, but as a case study in how cities carry the long afterlife of industrial collapse.
Later, domestic violence through the lens of winter, when confinement, financial stress, and isolation converge.
Stories about responsibility, institutional and personal, and how decisions ripple outward. This is the Metro.
We begin in Oakland County, where a child was diagnosed with measles yesterday. Now, this follows a series of major changes to federal vaccine recommendations and guidelines, made under the leadership of Robert F. Kennedy, Jr., Secretary of Health and Human Services. Kennedy is a longtime vaccine skeptic, and his views are becoming policy at the Centers for Disease Control and the Food and Drug Administration, both of which are under his supervision. These changes include loosening recommendations for infants and toddlers regarding hepatitis B, chickenpox, measles, mumps, and rubella. All of this forecasts a much tougher path for new vaccines to gain approval, and a tougher path for local health officials who are on the front lines trying to keep people safe from communicable diseases. Today, two of those public health leaders join me now. Dr. Teena Chopra is professor of infectious diseases at Wayne State University and assistant dean of professional development in the School of Medicine. And Kate Guzman is Oakland County's health officer. Welcome to both of you.
Thank you so much. Good morning.
You. Morning. Thank you for having us.
Good morning. Kate, I want to start with you. And the top headline here, which is that a child in Oakland County was diagnosed with measles yesterday. What do we know about that case as of this morning?
Thank you for asking. Measles cases have been on the rise, Robin, across the country, as you know, and this is our second case in Oakland County this year. And this is our first pediatric case, though. And so it really shines a light on the topic that you were just speaking about with childhood vaccination schedules and decisions being made by HHS. And so to be honest, we've been pretty much waiting for this case. We knew it would happen. We are seeing chickenpox cases cropping up. It was just any matter of time before a measles case, a pediatric measles case came to light. So this is a case I can't disclose too much information, but it was a child that had not yet been vaccinated, and the family had been traveling within the U.S., and so their exposure was outside of the state of Michigan. And then coming back, developing symptoms. We're fortunate that the family acted quickly and did the right thing. Their only possible exposure site is an emergency room at the Huron Valley Sinai Hospital in Commerce Township. And so that's what we're really hoping to communicate to the public. Because measles can stay in the air for 2 hours after an infected individual is in a space, we need to let the public know that if you were in the emergency room at the Huron Valley Sinai Hospital in Commerce Township on December 7th between 7:30 and 11:10 to be exact, and you're not vaccinated against measles, it's possible you could have been exposed. So this is the really tricky thing about measles, right? It's highly infectious.
And you are the measles person for Oakland County. What does that mean exactly?
Robin, you're funny because I was talking about our outbreak in 2019 just before the show. We had, we had a few dozen cases of measles in 2019 in Oakland County. And at that point, I wasn't the health officer yet. I was really boots on the ground, responding, vaccinating, testing, really working with clinicians and physicians to diagnose cases. And so I do feel fortunate in an odd way that I'm one of the few public health professionals or nurses that have seen so many cases of measles. So I've seen what it looks like. I've seen what it does to people. And I think there's so many healthcare workers that are of the generation that has never seen measles or never seen chickenpox, right? Because vaccines have been so successful.
Before I turn to Dr. Chopra, I do want to ask you one more thing about that, and that is, what does it feel like for you as a public health leader to see a disease that we once considered eradicated popping up in this way to a point where we're using the word outbreak?
Mm-hmm. It's demoralizing, Robin. I'll be honest. Not just for me, but for my public health professionals that I work with, my colleagues. It's so troubling. It keeps me up at night, I'll be very honest. Just where we're headed in public health and the implications and what's coming next.
Dr. Chopra, I want to turn to you now. I'm wondering what your reaction to CDC and FDA changes to vaccine guidelines has been. I mean, you are in a space where you're not only constantly thinking about this, you're talking to and instructing other health leaders and physicians on how to proceed. What has this been like for you to watch these guidelines loosen and change the way that they have?
Yeah, I think it's terrifying, to say it in one word, especially with the major shift on the hepatitis B vaccines for newborns. The fact that CDC has ended its long-standing universal recommendation that all newborns should receive hepatitis B vaccine at birth. So this is something really scary, and we are going to see hundreds of children getting this chronic liver disease because parents are going to have to make this shared decision, and many parents will move away from getting the vaccine.
Dr. Chopra, I want to stay on that point for a moment because RFK Jr. has falsely linked the vaccine to autism. He's also framed hepatitis B as a disease only affecting high-risk groups, and that is false. Why is it important for infants and children to get vaccines like hepatitis B early in life?
You rightly pointed out, Robin, that it is all false, and I would say rather disgraceful, to say this narrative. We are pretty much moving back to the pre-1991 era, when we started giving universal vaccines for hepatitis B. And what it means is that we are going to see a lot of disease. We are going to see a lot of vaccine-preventable diseases in our children. Hundreds of babies in the next decade who would otherwise not have contracted this deadly chronic liver disease will have it.
Of course, Dr. Chopra, bodily autonomy is part of the discussion here. I think we do have to try and understand the other side of things. I mean, one argument is that it's up to a parent or guardian to inoculate themselves or not, that concerned parents are free to give their kids vaccines and they'll be protected. What do you make of that view? Is there a shared risk to other babies and kids or other age groups when less children are vaccinated for something like hepatitis B or measles?
Absolutely. For measles, for example, there is a herd immunity. So when we are going by pseudoscience and not vaccinating our children, the other children in the group or in the school will be affected because the herd immunity will fall down. As you already saw, Canada lost the WHO eradication status for measles. We could be next, given that we have a national outbreak of measles in the country. So there's going to be a big loss, a shared loss, because I believe this is a shared responsibility.
And this has me thinking about the ways that Kate Guzman in Oakland County, how you have been trying to adapt your messaging, how you've been trying to adapt your protocols in the public health department. And before we talk about those, Dr. Chopra, one thing I'm wondering about in terms of that adaptation, the FDA and the CDC have long been standard bearers for public medical practice and research. But now these recent recommendations going against those same agencies' guidance in past years before RFK was appointed by President Trump. I mean, in your opinion, do medical practitioners and researchers need to start looking for a new standard bearer?
Absolutely. The American Academy of Pediatrics, the Infectious Disease Society of America are opposing these recommendations. And that's why also it's very confusing for the community, for parents. So parents will have to look at other organizations like the American Academy of Pediatrics to make those decisions.
Kate Guzman, back to you. I want to now talk about some of the ways that you're adapting your work and your messaging and how you look at the balance between personal choice and the health of the general public, which is so central to the work that you do.
Thank you, Robin. Coming out of the pandemic at Oakland County, we really recognized that the community didn't want to hear us telling them what to do anymore. And we heard that loud and clear, and we really were conscientious in our efforts to shift our advances and shift our approach. And I think we've been pretty successful in communicating in a way that is welcoming to families. Come on in, have the conversation. We'll provide you with the information that we have, the facts, the data, the statistics, and let's have a real conversation. Currently, it's shifting even a little bit more, where we have generations of new parents that have no fear of infectious disease like our parents had, like our grandparents had. And so what we're finding is that they're using the choice to vaccinate or not vaccinate as a political stance. So they're drawing a line in the sand and using this decision to vaccinate their infant as their point. It's a very challenging conversation to have when it's no longer about the child, it's no longer about the health and safety of the infant, but it's a political statement. And so that's where we're at in public health. This is the real challenge now, how to really assert ourselves as nonpartisan and assure families that we all have the same goal in mind. We all want healthy children that lead long, happy lives.
It sounds like this is a moment that is quite unprecedented in the world of public health in terms of how highly politicized, how weaponized the choice is becoming now to vaccinate or not to vaccinate. I'm wondering how you're having these conversations with parents, how you are delineating politics from this choice of vaccinating their children, which, as many of us know, is a choice that is not only going to protect kids, but it's going to more broadly protect people.
Yeah, we are focusing as a health division on families that are still on the fence about vaccines. I'll be very honest. That's where we think we can make some headway, where we can gain some momentum, are the families that are not concretely committed to a political stance on vaccines. Those families will come in, they will come in for their vaccine waivers. Many times they're not interested in a conversation or a discussion. That's not a debate. And so we're putting our energy where we think we can have the most effect, the most impact. And so we're really looking at families that are still on the fence, that are trying to cipher through trying to filter through all of the confusing information that's out there. And those are the families that I really want to reach out to. The ones that are just confused, they're just conflicted, their neighbors are telling them one thing, they're hearing something else at the salon, there are physicians telling them something else, and then on social media they're seeing something else, and so they're confused. And those are the families we're really focusing on because we have amazing information and we have such a great team of nurses that can provide that education.
So the folks on the fence are the ones you feel that you can still reach, and the ones who you interact with who are dogmatic, you're having to just throw in the towel with those folks for now.
Yeah, I mean, if you know anything about me, I never throw in the towel, Robin, because there's always hope.
For now.
I'm forever an optimist, yes. I think we need to ride out this wave a little bit and focus where we can because there are still plenty of families that don't have access to vaccines. I'm very worried about what these changes through the ACIP and the CDC will mean for insurance coverage and access and what the Medicaid cuts will do for access to vaccines. And so I'm very focused on those families that may lose access to vaccines. How do I get those vaccines out to them at a cost, at an affordable cost? And then again, that group that's still on the fence. So those are the two populations that I'm really focused on now for our health division.
It's the Metro on WDET. I'm Robin Vincent. My guests are Kate Guzman, Oakland County's Health Officer, and Dr. Teena Chopra, Professor of Infectious Diseases at Wayne State University. Yesterday, a case of measles was confirmed in Oakland County, and that's amid a rash of changes to federal vaccine recommendations under Robert F. Kennedy Jr., Secretary of Health and Human Services. Kate, taking measles as an example, do you think your approach in Oakland County can encourage those parents on the fence, the ones that you're really focused on now, to get the MMR vaccine before more measles cases emerge? I mean, it's a lot to communicate to parents. The kinds of deep conversations you're describing, they sound time intensive, and they sound like they're interactions that you have to chip away at. It's a slower process.
Yes, it is. It's a slow process, but it's worth the time. It's worth the investment. We are hoping that this measles case in Oakland County will spark some interest in individuals that maybe were on the fence about vaccinating. I'm hoping that families can see that this is real. It happens to our community members, and it happens to a normal family just like them. It could be their neighbor. It could be their schoolmate. Measles itself is such a great example because it's so infectious. And so the vaccine for measles should not be controversial because it is so effective. It's one of our best vaccines. It's one of the only vaccines that you can give someone after they've been exposed to measles. If you give it within 72 hours after the exposure, you can prevent the infection. It's an incredible vaccine. This case, I really hope, highlights for our community the importance of vaccinating and timely vaccination, because sometimes vaccinations seem like another errand or another task on a busy load for parents. I'm really hoping that this message today is don't wait until tomorrow and tomorrow and tomorrow and when you have time and after the holidays and when things slow down, because things never slow down as a parent. I know that. I'm a mom and a nurse and a health officer. So today is the day. It's timely. Vaccinations are for today.
Kate, this has me wondering, with the different families that you've worked with where their children have contracted some of these illnesses, do you notice a strong change from parents who were not willing to vaccinate their kids? Their kids got sick. We saw something happen with COVID that was very interesting, is that even after some people contracted the disease and didn't believe in it, I mean, they were fighting the rationale behind it till they were very sick or even till their dying day. Are you seeing a shift?
There's just still a mindset, I will tell you, for people who are adamant against vaccine, there's still a mindset that the infection was better than the vaccine, specifically regarding childhood diseases. And so there's still this prevailing mindset that natural immunity is better for their child than vaccine immunity. And that's what scares me. So you have families that are intentionally exposing their children to infectious diseases like chickenpox. The concept of chickenpox parties hasn't died out, and it has become measles parties. And so it's terrifying to me to think that families are intentionally exposing their children to these infectious diseases that can be life-threatening. So people think about measles as a rash, think about chickenpox as a nuisance. But when they develop beyond the standard disease and they go into encephalopathy, swelling in the brain, long-term hearing loss, pneumonia, you get hospitalizations, and eventually you could lead to death. And these are serious diseases, and we have forgotten the implication of that.
And hopefully we can get back there. I was just talking with my mom recently, and she told me about how my grandparents cried when certain vaccines came online.
You just give me goosebumps. I'm not even kidding.
But yeah, this was such a different time.
Yes.
And now the irony is that because of those medical and scientific breakthroughs, we eradicated all of these illnesses. And now we have a whole generation of parents who don't have that experience, who don't know about the tearful relief of all of a sudden being safeguarded against an illness. Dr. Chopra, I want to bring you back in for our final moment here. I'm wondering, how do you teach the next generation of physicians to talk to patients about vaccines in the current moment we're in? And this is in the last 30 seconds we have.
Sure. We are focusing on building trust with our families, with our parents, and parents basically want to protect their children. So we ask them their myths and facts that they know of first, and try to reduce defensiveness and build trust before introducing science. So we are trying to focus on that. Our medical students are coming on the front lines and talking to families, talking to communities. We are running a vaccine ambassador program where we are empowering our youth and helping them understand various myths around vaccines, history of vaccines, like you guys were talking about, how were vaccines discovered, all of that to bring them on the same page as science is.
Dr. Teena Chopra is a professor of infectious diseases at Wayne State University and assistant dean of professional development in the School of Medicine. And Kate Guzman is the health officer for Oakland County. Thank you both so much for your work and for joining us today.
Thank you. It's been an honor.
Thank you. Thank you for having us. Bye-bye.
Metro on WDET. Up next, some people are concerned about student autonomy and attention declining due to social media use. One Metro Detroit superintendent has been on a mission to change that. We'll find out more next here on the Metro. Stay with us.